Welcome to our comprehensive guide on nutritional requirements. In this video, we'll explore the essential concepts behind how much energy and nutrients our bodies need to function optimally. Understanding these requirements is key to promoting health and preventing disease. We'll start by defining what nutritional requirements are, then move into the scientific principles, public health applications, and the unique factors that influence these needs. Let's begin our journey into the world of nutrition and discover why these requirements matter for everyone. Nutritional requirements refer to the amount of energy and nutrients necessary to maintain normal body functions, support growth and development, prevent deficiencies and toxicities, and promote optimal health throughout life. These requirements are not just about individual needs, they're often expressed as population-based reference values. This approach helps public health professionals create guidelines that benefit entire communities, rather than focusing on one person at a time. By understanding these requirements, we can better support health at every stage of life. Nutritional requirements play a critical role in public health. They guide the development of dietary guidelines and food-based recommendations, inform food fortification and supplementation programs, and support nutrition surveillance and planning. By using these requirements, public health officials can estimate whether a population is at risk of nutrient inadequacy or excess. This information is vital for designing effective interventions and ensuring that communities have access to the nutrients they need for good health. Nutrient reference values, or NRVs, are scientifically derived estimates of nutrient intakes used to assess and plan diets for populations. NRVs take into account individual variability, differences in age, sex, and physiological status, as well as uncertainties in measurement. These values provide a framework for public health nutrition, helping professionals make informed decisions about dietary recommendations and interventions. There are several types of nutrient reference levels, each serving a specific purpose. The estimated average requirement, EAR, meets the needs of 50% of individuals in a group and is used to assess population inadequacy. The recommended dietary allowance, RDA, covers the needs of 97–98% of healthy individuals and is derived from the EAR plus a safety margin. Adequate intake, AI, is used when EAR or RDA cannot be determined, based on observed intakes in healthy populations. The tolerable upper intake level, UL, is the maximum daily intake unlikely to cause adverse effects. Nutrient reference values are applied in various ways in public health. The EAR is used to assess the prevalence of nutrient inadequacy in populations. The RDA and AI help plan diets and develop guidelines, while the UL is crucial for preventing toxicity. By matching the right NRV to the right purpose, public health professionals can better address the nutritional needs of communities and prevent both deficiencies and excesses. Developing nutrient reference values is a rigorous scientific process. Researchers use balance studies, factorial approaches, depletion, repletion studies, epidemiological evidence, and clinical outcomes to determine the optimal intake levels for different nutrients. This evidence-based approach ensures that NRVs are grounded in the best available science and reflect the needs of diverse populations. There are several approaches to estimating nutritional requirements. The factorial method estimates needs based on basal losses, growth, and demands during pregnancy and lactation. Balanced studies compare nutrient intake to excretion, often used for protein and minerals. Functional outcomes identify the intake level at which health is optimized and deficiency signs disappear. Each method provides valuable insights into how much of each nutrient is necessary for health. Developing nutrient reference values is not without challenges. Ethical constraints limit experimentation, especially in vulnerable groups. There's often limited data from low-income countries, and genetic and environmental variations can affect nutrient needs. Additionally, nutrients interact with each other in complex ways, making it difficult to isolate the effects of individual nutrients. These challenges highlight the importance of ongoing research and adaptation. Several key principles guide the determination of nutritional requirements. Requirements vary between individuals and change across the life cycle. Bioavailability, the proportion of a nutrient absorbed and used by the body, plays a significant role. Disease and infection can alter requirements, and it's important to prevent both deficiency and excess. These principles ensure that recommendations are tailored to real-world needs. Bioavailability refers to the proportion of a nutrient that is absorbed and utilized by the body. It is influenced by the food matrix, the presence of inhibitors like phytates, enhancers such as vitamin C for iron, and gut health. In diets rich in cereals and legumes, like those common in Ethiopia, bioavailability is especially important. Understanding bioavailability helps ensure that dietary recommendations are effective in real-world settings. Nutrient reference values are used at the population level to develop food-based dietary guidelines, plan school feeding programs, design supplementation and fortification strategies, assess dietary survey data, and monitor the progress of nutrition programs. These applications help ensure that public health interventions are evidence-based and tailored to the needs of specific communities. While nutrient reference values are essential tools, they have limitations. NRVs are not exact prescriptions for individuals and may not fully reflect local diets or the bioavailability of nutrients in specific foods. They require contextual adaptation to be effective in different settings. Recognizing these limitations is crucial for designing nutrition programs that truly meet the needs of diverse populations. Biological factors such as age, sex, body size and composition, and physiological status all influence nutritional requirements. For example, children, pregnant women, and older adults have different needs compared to the general adult population. Understanding these differences is key to developing effective dietary recommendations and interventions. Environmental and health factors also play a significant role in determining nutritional requirements. Climate, disease burden, such as infections or HIV, and physical activity levels can all impact how much of each nutrient is needed. For instance, people living in hot climates or those with high physical activity may require more water and certain nutrients. Dietary factors such as food availability, dietary diversity, cultural practices, and cooking or food processing methods influence nutritional requirements. For example, limited access to a variety of foods can increase the risk of deficiencies, while certain cooking methods may reduce the nutrient content of foods. Understanding these factors helps tailor nutrition programs to local contexts. Socioeconomic factors such as income, education, gender norms, and food access significantly affect nutritional requirements and dietary choices. People with higher incomes and education levels often have better access to a variety of nutritious foods, while gender norms can influence who eats what within a household. Addressing these factors is essential for promoting equitable nutrition. In Ethiopia, nutritional requirements have practical implications for public health programming. Efforts include fortification of staple foods, iron, folic acid supplementation, targeted interventions for vulnerable groups, and nutrition-sensitive agriculture. These strategies aim to address the unique nutritional challenges faced by the Ethiopian population and improve overall health outcomes. Despite ongoing efforts, Ethiopia faces several key challenges in meeting nutritional requirements. These include low dietary diversity, a high burden of infections, limited access to animal-source foods, and cultural feeding practices that may restrict nutrient intake. Addressing these challenges requires innovative, context-specific solutions and strong public health leadership. A critical part of public health nutrition is reviewing and summarizing national dietary guidelines. For example, the Ethiopian Food-Based Dietary Guideline 2022 provides evidence-based recommendations tailored to local needs and food availability. These guidelines help shape policies and programs that promote better nutrition across the country. For those interested in learning more, there are several key resources available. Recommended readings include Public Health Nutrition by Buttress J.L. and Elsa A., WHO Global Nutrition Policy Documents, the Food and Nutrition Policy of Ethiopia, and the Ethiopian Food-Based Dietary Guidelines. These materials provide valuable insights into the science and practice of public health nutrition. Let's recap the key takeaways from our discussion. Nutritional requirements are population-based estimates that guide public health action. Nutrient reference values are not individual prescriptions, but tools for planning and assessment. Life stage, context, and bioavailability all influence requirements, and evidence-based approaches are essential for effective nutrition programs. As we move forward, it's important to continue updating our understanding of nutritional requirements based on new research and changing population needs. Ongoing monitoring, evaluation, and adaptation are key to ensuring that nutrition programs remain effective and relevant. Thank you for joining us on this journey through the fundamentals of nutritional requirements. We hope this video has provided you with a clearer understanding of how these requirements are determined, why they matter, and how they are applied in public health. Stay curious and keep learning about the science of nutrition. Nutrition is a dynamic field, and staying informed is essential for both professionals and the public. Keep exploring reputable sources, engage with new research, and consider how you can apply this knowledge in your own life or community. Together, we can work towards better nutrition and health for all.